We have to get out of this, oh, shucks, isn't this unfair conversation. I'm tired of that stuff. I get it. It's frustrating, but I get it. But until we get to, oh, shucks, to where this is a better experience and somebody's making money off me, we're in a good spot. Apple makes a lot of money off me, and I'm fine because Apple delivers a lot of value to me. But right now, it's not like, oh, greedy Apple is gouging me. Like, no, there's a way to deliver better experiences, better outcomes, all in line with your healthcare consumerism and be fiscally minded, but it requires new care models. It requires rethinking like primary care. The answer is there, but we have to have much more honest conversations about the business side. Otherwise, it's woe is me. And that's not going to change much.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the flavor of the week about Amazon One Medical's first partnership in the at-home preventive screening space. How is their newly announced partnership with Reperio Health a signal of growth for preventive care? And which consumer attributes of their solution can appeal to the masses? I'll talk about that. Then my co-conspirator Paul Schrimpf returns to highlight trends he's uncovering, from workforce configuration to the primary care backbone to the platformification of care delivery, all delivered with his trademark combo of realism and wit. I'm Jared Johnson. Let's get it.
Flavor of the week.
Amazon just announced its first partnership for at-home preventive screening, and it's with a familiar face. I'm excited for our friends at Reperio Health, who announced on January 28th that they're teaming up with Amazon One Medical to expand access to primary care. Reperio works with employers to offer at-home health screenings with instant results. They're also launching Reperio Care, which adds an on-demand virtual visit with a contracted clinician to interpret those results. Employees using the service can then take advantage of an included One Medical membership for ongoing primary care. The partnership's goal is to streamline the path from early detection to ongoing primary care, particularly in rural areas. The process of a Reperio at-home screening kit, including a consult, takes between 30 minutes and an hour. Reperio leverages existing FDA-cleared devices, not its own. So instead of consumers having to buy each device, Reperio loans them out, and that makes it cheaper. They get shipped to a consumer's home, and after they're done being used, they get picked up, sterilized, and reused. Zane and I first spoke with their founder, Travis Rush, last year at Vive, and then later in the year, each tried out the at-home kit and compared our experiences. Links to those episodes can be found in the show notes, but in summary, I see why One Medical would want to partner with them. After all, it gives you a remarkable window into your health in about as little time as it can possibly take, a lot more convenience than traveling to a lab, and more importantly, practically no waiting for your results. What's the consumer lens? This partnership is another signal that preventive care is more accessible than ever before for consumers. I mean, come on, a screening kit that can be mailed anywhere, can be completed at home with clear instructions without visiting a lab or doctor's office, and results that come almost instantaneously with insights that help you interpret what they mean for you? Does it really get much more consumer-centered than that? No wonder the Reperio kit is on the radar screen of some of the biggest players in healthcare. Let's double down on innovation in preventive care as Amazon and other big players explore their next partnerships in the space. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week. Hey, I'm here with my friend Carol Flagg from Healthcare Now Radio. Carol, you and I have an exciting new partnership that we want to tell people about.
Yep, we'll actually be launching an exclusive new opportunity called Limited Series. And these series will air nationally on Healthcare Now Radio, which, by the way, was named once again as one of the top 10 healthcare shows again in 2025, as well as here on the Healthcare Now Wrap. These series are going to cover some of the biggest topics in 2026, starting with rural health and including the CMS health tech ecosystem, GLP-1s, wearables, and more. So we're really excited about these series because there's a lot to talk about with these topics, which means they are ideal opportunities to create thought leaders in these spaces.
Yeah, Carol, that's what I'm the most excited about, is to really generate more informed, trusted information on these topics. And for those who are interested, spots are extremely limited for Q2 through Q4 of 2026. To get started, just reach out to either of us on LinkedIn, and we look forward to hearing from you. Hey, let's get to the flow. Paul Schrimpf. Wow, it's been a minute. Welcome back to the show.
Thanks, Jared. Great to be back in the flow.
For those who are familiar and have been listening / watching over the years, Paul has been an on and off contributor for years now, has contributed to our prediction series last year, and is just a friend of the show, as they say. So glad to have you back.
Likewise, always fun to have a conversation.
Well, it's funny how this conversation even came up organically the last few times we've stayed connected this last year in terms of the things that you have going on, the type of work, the type of engagements you have going on right now has always been intriguing to me. And I think you're going in a place that not many people have gone, honestly. And I think part of that's based on some of the insights that you've been able to generate. Maybe it's worth just kind of recalibrating for the audience in terms of where you're at now, where you're focusing, and then we can dig into some of the insights that you've been discovering lately.
Yeah, I'm still on a quest to make my introduction shorter than it typically is. But essentially, I'm still playing in a space that I call all things commercialization as it relates to healthcare. And that's like growing top line revenue. I know folks kind of get a little weird with that, particularly the provider side, about how we treat healthcare like a business. But every time we go to the polls and elect officials and say we don't want government healthcare and we want it privatized, we are dropping it into a capitalistic model. And for that capitalistic model to work, you need to be making money and you need to be keeping your doors open, which requires margin. Healthcare is full of blind spots. And I've got more than my fair share of mine as well.
You have a pretty unique method, I feel like, right now of generating content that's leading you to some of those aha moments.
Where we're going to go in this conversation probably started several years ago, where I found myself talking with people and resharing conversations I had with other professionals in my network. And I said, oh, it might be interesting to, if those people are interested, record them. It was the boom of the podcast. You and I were chatting about that quite extensively, 2019, 2020, and obviously 2020, we saw a spur with the pandemic. So I started recording conversations. Just instead of me saying, hey, saying third person when I talked to about somebody else, I just shared a podcast interview. And then I realized that got very eclectic because it was just a bunch of random conversations Paul's having with people he knows that he thinks are interesting. And then I began shaping those around themes like, oh, I'm having some great conversations around product development, product launches, product management. Let's talk to 12 healthcare product managers and see what they have to say, or physician leaders, so we can see the world through doctors' eyes who are running businesses. And I thought that was interesting. But I think what we're seeing today with content is just content chaos, content flood. It's so easy to make content. It's so easy to auto-publish. So we just get inundated with stuff. And I was a talking head like anybody else. I still am. I'm still rambling here for about 5 minutes. But nobody needed to hear my opinion anymore. And there's enough content out there that we can begin aggregating. So I started dabbling in that. And you and I have kind of collaborated on some fun stuff in which I'm taking your podcasts, aggregating them and saying, what are some latent themes? It's easy to figure out what the central theme of each of your episodes are. But it's a lot of fun to saying, what was some secondary or third topics that came up across 10 episodes? And what does that tell us about some things? And it's less about my opinions in one person. It's me just curating a lot of things that's already out there. And I'm doing that with your podcast and a few episodes coming up. And I started with, you square that with really hard data and say, is this my opinion or can I substantiate this? It's very opinion oriented, but that's kind of where my world's going, is just taking this pattern recognition skill in organic conversations and supercharging it in the modern era of AI and large language models.
Okay, so there's a couple here. Let me just point to a couple maybe that you've had in report form and maybe just get some thoughts or insights or things that stuck out to these. And here are examples. One was like workforce reconfiguration. Workforce is something you've spent a lot of time looking at and thinking about. Like, just tell us like some of the things that have stood out as you've been investigating there.
This was pulled out using some AI models, looking at your episodes alone. What I found fascinating is it squared with some of the episodes Jeffrey Roche and I did a couple of years ago on the workforce shortage, namely around nurses. But it's fascinating that we believe, and I think it's true, we're short on clinicians. But if you look at the amount of clinicians out there, there's a lot of them, and they're all just somewhat unevenly distributed. And then you get into a lot of conversations about nurse to patient ratios, doctor to patient ratios, and a lot of things that kind of don't square. And this was first planted with me with my interview with Marcus Osborne at the time heading up Walmart Health. It's like, you don't have a shortage, we have a model problem. And you start looking at it going, nowhere else do we see, oh, do we have a pilot to passenger problem in airlines? Do we have a mechanic to car ratio problem in automotive repair? We don't. We rethink models and try to get it scaling. And the other thing, which it squared with, which was my work with nurse experience and nurse retention, is nurses care a lot, insanely a lot. It's a strength. But what we find is the other side of that coin is they have a really hard time delegating. So you'll see a nurse who's exhausted and saying, we don't have enough nurses. And then you give them some junior nurses, but they don't actually delegate their work because they're afraid to let somebody else do the work that they are very proud of. And then you have these other things that pop up, which is we want to make sure people operate at the top of their license. You see that at every healthcare conference. Well, if everybody did that, nobody'd take out the garbage. So there's a thing that we need to wrestle around. We don't want people doing remedial work, but we also don't want 8 people around a patient doing the job. So how do we think about the care models? And we're also seeing that be getting deployed when you've got provider-sponsored plans who are making big bets into value-based care, rethinking models. But it's a great little kind of conversation that I think was naturally out there that kind of came up through a lot of your episodes and some curation. You hear a microdosing podcast now, it's usually written and curated. It's more curated, but taking things that are out there and shaping it a bit and supporting it. And I thought Kelly Gill, Ed Marks, and Elizabeth kind of all had really great comments. And it's just like, oh, this idea is gold. And now you got 3 or more episodes you can go to Healthcare Wrap and go deep on because those people kind of talked about it, but it was intersecting with a different topic you guys were talking about that day.
Hey y'all, I'm here with Israel Crush, founder of Hyro. Israel, what's an easy to understand example of how an AI agent can help consumers in their health journeys?
A simple section would be the fact that instead of enrolling into Medicaid and proving that you're eligible once a year, you need to do it once every 6 months. Patients don't know that. So we said, you know what, we're going to get ahead of that and we're going to educate patients about some of those changes and try to get them re-enrolled or redetermine their enrollment into those programs to make sure that 1, they're covered, and 2, that the health system gets paid or reimbursed for those patients. So I think that's a clear win-win where you create an AI agent that is proactively helping both patients and health systems with issues that they face and make, again, the journey a little less complicated.
Thanks, Israel. Visit hyro.ai for more information. That's HYRO.ai. And tell them you heard about it on Healthcare Wrap. Well, and I'll tell you, once you start plugging those into any kind of AI generated content model too, and you start thinking, what are the easy low-hanging fruit pieces of content that AI helps with? Sure, it'll generate your transcript, it'll generate your show notes, it'll even pull clips for you, which is great, and it's all helpful. And I do use a lot of those features, but is that tool looking for those things yet? No, it's still the human looking for those things. To your point of having the model of those insights and then additional curation. The ones you mentioned, Kelly Gill, so an executive recruiter, talent manager, and then Elizabeth, on the nursing side from Avasure, and then Ed Marks, from the IT side, who could speak all day long about where health IT fits in all that and team structure and leadership and things. Yeah, things that wouldn't necessarily, I would never have all 3 of them on the same episode either.
No, you wouldn't be. But when more you think about it, there's a lot of innovation being launched and promised that requires it being dropped into a new operating model. So when Ed kind of riffs about you can launch, oh, this is essential to value-based care. But then you'll see in other reports, and this is kind of outside of the core that we're talking about this month, almost all of healthcare's infrastructure conceptually and from a technology perspective is based on fee for service. And we're jamming a value-based care model into that. And then you try to launch a new piece of innovation into that. And then you've got workforce model wrapped around that. So that's kind of where you see this kind of this lovely chocolate and peanut butter conversation come out of an Ed Marks episode and a Kelly Gill episode that lives in the middle.
That's a great example of one. Let me throw another topic at you. One of your recent reports, which is the primary care backbone. I found a lot of interest in this because we've spoken to so many different of those models. Like you're saying, we're trying to drop in new models here, value-based care in all of its different forms. And my takeaway is always like, should we be surprised at the results? Like if we're actually thinking about what we are dropping in to the system that exists here. But curious what insights were sticking out to you from that report.
Yeah, and this kind of overlaps what I was just riffing on, is we're seeing pockets of promise where I'm wanting to see it, or I think I'm seeing it. It's hard to see evidence because so many health systems are private. Health systems first saying, you know what, we don't like their reimbursement rates. And some of these bigger ones are kind of getting into spats with health insurers. I think payer provider disputes are up 70%. And you're seeing a move to narrow networks as payers are already kind of trimming that down. And you're seeing providers going, we're just going to take our own networks. We're going to bet that our patients follow us and not the payer. And that requires a few different models. But we actually have whole health systems going at full risk for a proportion of their population. Now, how do you manage that risk? You need primary care. So you see a double move where health systems are saying we're going to go full risk at a population. We're going to embrace value-based care. And that strategy shoots off a number of other things that I can riff on for an hour. But one of them is, how do we make primary care a strategic asset? That is a flip from 5 years ago when it was his own care setting, operating his own P&L and making terrible margins and nobody wanted anything to do with it. But when you drop primary care into a health system that's going full risk, you rethink your work model, the one before, and you're able to kind of think through it differently, because now you get an interesting argument of saying, I've got, let's just pick on open exchanges, somebody on a bronze plan, narrow network that doesn't want to use their healthcare. The faster I see that person in a year say, fine, you're healthy and see you next year, I'm pocketing all those premiums in a good way. And if you take 2022 Paul, who was pounding on his desk going, you tell me somebody who's making money off me and I'll tell you a real value-based care plan. Otherwise, I think VBC was BS. I'm now seeing people profiting on me staying healthier. I know we don't like to use that term in healthcare, but that's the role of primary care. If you get primary care working, efficiently triaging complex and chronic condition people, or efficiently seeing mild, low risk people, and you're collecting that premium every month, you now have a business model you can wrap around, but it requires primary care being a very important chess piece on that board.
Yeah, I want to hear more of that conversation. I hope we hear more of that at conferences in 2026. I hope we hear more of that as the years go by, because it's based on, like, let's not repeat the same conversations we've had. And that's what I hear constantly. And that's another reason why I look to these types of conversations, because not only do we not need to reinvent the wheel, like we're losing time, and there's a very narrow window for actual progress here before like the wheels can fall off of the financial engine here.
And we have to get out of this, oh, shucks, isn't this unfair conversation? I'm tired of that stuff. I get it. It's frustrating. I had the most helpless feeling I've ever had in my life dealing with my health insurer earlier in the year, switching plans. But I get it. But until we get to, oh, shucks, to where this is a better experience and somebody's making money off me, we're in a good spot. Apple makes a lot of money off me, and I'm fine because Apple delivers a lot of value to me. But right now, it's not like, oh, greedy Apple is gouging me. Like, no, there's a way to deliver better experiences, better outcomes, all in line with your healthcare consumerism, and be fiscally minded. But it requires new care models. It requires rethinking like primary care. The answer is there, but we have to have much more honest conversations about the business side. Otherwise, it's woe is me. And that's not going to change much.
Yeah, again, it's a conversation I'm not hearing enough yet. I hope people kind of listen to this and kind of start to see what's possible other than just let me use AI to generate more stuff. One more report of yours, if we have a couple minutes here. There's one on platformification, which I love the word. It's worth diving into this one too, I think, because it's related.
This one's fascinating, is the interconnectedness. And I felt we were regressing when you and I were at a recent health conference, and we've been to previously. It felt like we went in reverse this year at that conference. And the biggest thing that stood out to me was the abundance of point solution conversations. And as I mentioned about the care model and the integration, but like a lot of individual pieces of innovation are dependent on other things working together and how that plugs together. And I think thinking about the platform and it's so weird for me to talk about this. I swear I was talking about this 10 years ago. And it was so funny because the word platform is a boring term outside of healthcare. It is overused and dull. But I swear 10 years ago, I would talk to one of my clients and say, well, we want to try to kind of bridge this consumer or customer or patient aspect with this other community. And we're creating this hub that's like part community and part commercial model. And be like, oh, you mean a platform? No, it's like a hub. Like it's just like, so like, it's like we were describing it, but not knowing that books are written about this and have been written about this for 50 years. But trying to figure out how we're creating these platforms, and this can connect technologically in terms of like a tech platform. That's how most people think about it. But there's also business platforms and a variety of other ways of talking about platforms, which is a way of connecting piece parts together. And I'm going to keep it as vague as that, but you need to be figuring out how your business product solution plugs into a bigger ecosystem. I hate using these vague terms, but until you understand this flow, it gets very confusing. Like, for instance, the one thing I'm using, which is the easiest to talk about because it's the only topic that's hot and getting capital right now, is prior authorization. But when you talk about prior authorization as a patient, as a doctor, as a pharmacist, as a payer, as a pharma company, it frustrates everybody. At one point, when everybody's on these journeys, all of a sudden, everybody's waiting to see if this is approved or not approved and has been approved in the right way. But if you're dealing with prior auth as it relates to medication management, and you're not sewing together what the pharmacist experience is, the pharma experience, and the prescriber experience, as well as the patient experience, let's kick in a caregiver, like there's 5 things that are hitting the collision course right there. And if you go into like procedure referrals, you've got primary care and specialists and all these other things, but there's these different vectors. One, no patient continuum is linear. And I love this other one. I got this from Christy Hill, who headed up the kind of customer experience at Eli Lilly. It's like, we're living in a world of intersecting journeys. Sometimes they're patient journeys. Sometimes they're provider journeys. Sometimes they're going aside. But like understanding how your point intersects with this web of other things, don't need to solve for it all, is incredible. But that's the platformification of it all. I may or may not keep that in the final run, but just trying to figure out where this lives at a higher level, not just, gee, I hope you like this less invasive cancer test and you buy it at face value. That's not selling right now in 2026.
There is such a challenge in labeling something a platform and saying now this solves everything, because then you get into the habit of trying to say this solves all the problems, and then like your buyers, like you've lost your buyers already. And so like there's a bit of a conundrum there.
Yeah, it makes things harder. So if you don't like hard things and solving hard problems, that one's not great because it's easier to try to talk about how this little breathalyzer can detect liver cancer. But when you think about the concept, conceptually, try to divorce it from the tech platform thing. When you view primary care as a platform, you're now thinking of it differently. Like, how do I bring point of care testing into primary care if I'm treating as a platform? Because right now there's nothing broken with you seeing a primary care doctor and going downstairs and doing your labs. And a payer is going to say, there's nothing broken with that. We're not going to pay you to bring your lab into your primary care business. But if you're viewing a new care model, primary care is a strategic asset, and rethinking that as a platform, yeah, why wouldn't I do my A1Cs at my point of care? Because you can do it within seconds, but nobody wants to pay for it if you're viewing it in the old model. And that's just like one example.
Well, this is what happens when we start connecting some dots here, Paul. Like when we start not...
I just thought I'd serve up like new content or curated content, because I think there's a lot. What I've always found fascinating about healthcare is it looks messy on top, and we all see symptoms, and we're all kind of feeling our way around the elephant. But right underneath the surface, there's actually some great vectors of insights that if we just take a couple extra seconds to look at them differently or longer, the answers begin to emerge with a little bit more higher fidelity than the messiness that we see today.
Well said. Yeah, the high fidelity piece. I wonder if we end up working on one that is even more longitudinal with more episodes, and we grab as many founders as I can find that we've spoken to over the years and just connect the dots of the problem solving attempt. Hey, this thing happened to me personally, or to a family member or somebody I cared about. I mean, there's a kind of a format for the majority, not all, but the majority of founder stories in this space. And what can we learn from that and not repeat like the ones that end up failing? Because again, lots of reasons why startups don't hit the goals that they set out to achieve, but there are some things for us to learn at that higher fidelity level. I may borrow that term.
Go for it. I mean, I think there's two things that we have a hard time calling out. I think you and I have touched on this before. And I'll share my personal. I don't think healthcare should be privatized. I think it should be like the rest of the world. I think it's like fire department, police, and schools. Like when my house catches on fire, I don't call the fire department going, hey, can you come? They go, oh, we're not covered in your plan. So there's a lot of societal things that I think when we go, oh, poor me, we go to a societal thing. In most instances, societal things are kind of government run and owned, where we see in the other 200 countries. So we've dropped it into a capitalist model. I'm not going to say it's good or bad. I'm just saying that's the one we're dealing with. So we are in a business model. We need to make money. The second piece, which people forget about, is we don't have control as consumers. I want more control, and it drives me nuts when I don't. But every year when I say, you know what, I'm not going to pay out of pocket and I'm going to give my money to insurance, and insurance is going to govern how I use care, I'm no longer in control in the consumer. So when people go, oh, it's about the patient and about the consumer, and I know you've had debates over this, we're not. There's an interesting kind of fiduciary intermediary model in a capitalistic system. And until you understand who's cutting checks and whose behavior you need to change for your product to be adopted or something to happen, you're just talking to yourself. But those are two Herculean topics that we're not going to solve for, and we'll take like government and kind of democratic efforts to getting it done. But once you kind of recognize that, you're playing a whole new ball game, and those playing that ball game are the companies that we're seeing grow. It's another pattern recognition.
What else haven't we talked about that's worth just bringing up at this point?
The one I think is very specific more to 2026 and 2027, because Medicaid is essentially the Fed for healthcare reimbursement. Like the Fed drops the rates or raises the rates, everything in financial services follows. When you make adjustments to Medicaid or CMS, that resets everybody's reimbursement. So we're already seeing cutbacks on policy that doesn't take effect till end of 2026. So all that stuff that was in the news late in mid 2025 doesn't come into 2026, but we're already seeing providers make cutbacks, do layoffs in advance. So this gets to the ROI question. We're still seeing too many debates around going, oh, if we do this, it helps patient populations and it keeps somebody from crashing to dialysis 7 years from now. Nobody's buying that pitch anymore. You need immediate ROI of saying we can spot somebody, we can control it, and we can address it. But that was another great conversation with Peter Chang and Chris McGee on just talking about the importance of, if you've got a healthcare innovation, yes, it should save people's lives, keep them safe, but you need to be able to prove the ROI immediately within 1 to 2 cycles, not 3 to 5 years. And that's another little episode I pulled together off, 4 or 5 of your own episodes where people were talking about it, and we just kind of pulled it into one and put a short point on it.
Yeah, and for those who aren't familiar, Peter Chang from Tampa General Hospital and Chris McGee, founder of Current Health, which was at one point the partner for Best Buy Health in-house and then got divested, and now they're still partnering with Best Buy Health. But yeah, lots of insights there. Let's do this again. Let's set our watches and plan this again, because again, just worth picking your brain, hearing what you're hearing. And I think it's worth people seeing hopefully what's possible when we start connecting dots a little more. So I appreciate the time, Paul. Let's do it again.
Absolutely. I love taking your content and playing it back to you. This is fun.
Thanks, man.
Appreciate you.